Great honor to me to spend the several next minutes with you talking about the potential of virtual reality rehabilitation. First of all, we cannot ignore that artificial intelligence invades our life in general and physical therapy in particular. Before starting talking about virtual reality, we have to differentiate between two words, virtual reality and augmented reality. What is the difference between both of them? Virtual reality is immersing the individual totally and completely in a stimulated environment, in a state of a real environment which he lives. Okay, this environment is customized and personalized according to the individual needs and capabilities. Augmented reality is just augmenting the surrounding of the patient by adding digital elements to the real life by using camera or smartphones. Virtual reality used in physical therapy in different aspects: neurological condition, musculoskeletal, and cognitive therapy. In neurological condition, virtual reality is used for a stroke patient to improve postural balance, gait performance, and motor performance, and reducing the incidence of fall for these persons. Also, it's used for patients suffering from Parkinsonism, developmental delay, and multiple sclerosis, ADD, and autism. And lately, it's used for treatment of patients suffering from chronic pain. Chronic pain is defined as a pain which persists for more than 3 to 6 months, mainly pain with neuropathy, arthritis, and fibromyalgia. Chronic pain, according to the latest research published in 2022, 20.4% of the world population affected with chronic pain, with its negative impact on the health of individual. Chronic pain affects the person negatively, physically, mentally, socially, and psychologically. At the first, it affects the patient negatively on a physical state as it limits his ability to perform his daily living activities. It limits his employment activities, makes the patient need to rest more, which limits the power of the muscle, causing weight loss or weight gain. Socially and psychologically, chronic pain makes the patient more anxious, more stressed, more depressed, and leading social isolation. And we haven't forget the negative side effect of medication. So, according to the Center for Disease Control and Prevention guideline, which recommended that non-pharmacological therapies is highly recommended for rehabilitation of chronic pain rather than pharmacological therapy. Non-pharmacological therapy like physiotherapy, behavioral, and cognitive therapy. So the benefits of virtual reality is that it provides non-pharmacological, non-invasive method for rehabilitation, which provide safe environment to the patient with customized, individualized, personalized program according to the patient needs and patient ability. And also it provides engagement, biofeedback, and the real-time guidance for the patient, which motivates the patient and engaging the patient more in the rehabilitation program. Also, it affects the patients highly in psychological aspects. And according to the latest researches, systematic reviews and meta-analysis which published in 2023, it shows that virtual reality encourages a positive side effect on pain, as it reduces the intensity of pain depends on numerical pain rating scale and visual analog scale, improves range of motion, improves motor performance and muscle activity, improves the quality of life, reduces the stress and anxiety of the patient while applying the exercise program. For example, Hoffman 2000 investigates the effect of virtual reality on patients with burn pain while applying the exercise. And this study showed that the perception of pain of the patient suffering from burn is reduced while applying the exercise. Malloy 2010 examines the effectiveness of virtual reality on distraction of pain, and it was a systematic review also. It shows that there is a positive effect on the pain intensity, quality of life, and motor performance. Jones 2016 examines the impact of virtual reality on patients with chronic pain, also shows reduce the pain intensity and improves the power of muscle. Finally, Sato 2021 examines virtual reality therapy for chronic pain with spinal injury and shows that virtual reality aims able to improve the pain intensity, quality of life, and physical activity performance. Okay, what is the mechanism which underlines the hypoalgesic effect of virtual reality? Hypoalgesic effect is meant by the reduced pain level of virtual reality. We cannot ignore that hypoalgesic mechanism with virtual reality is multimodal. It mediated by different dimensions of pain: sensory, affective, evaluative, cognitive, and motor behavior. First one, distraction. Immersing the individual into interesting environment distracts the brain from focusing on the negative experience of pain and negative thoughts into an interesting environment, which allows the patient to improve his pain perception. We have to consider the distraction effect is just temporary effect. So we can use this effect while dealing with children, while dealing with patients suffering from burn, while dealing with dental therapy, labor pain, which need some distraction away from the painful stimuli that occurred. Second mechanism is altering sensory motor decision making, and this depends on a neurophysiological hypothesis. Before starting discussing this mechanism, we have to state that the pain makes the brain defense, okay, in some way called fear avoidance. What is the fear avoidance mechanism? Is just a proactive defensive mechanism which makes the brain avoid any further motion to avoid more pain, okay? And this is changed while applying virtual reality, as while immersing the subject or individual into an interesting environment, they send a visual, auditory, and tactile stimuli to the brain. This traveled information through the afferent sensory neuron to the higher center of brain make some degrees of a change state evaluation. It changes the evaluation of environment and evaluation of body shape, makes the brain change its situation from a proactive defensive mechanism into a guided motor command. How it occurred? Because the brain thing is changed from the past and the previous environment, real environment of pain, from the painful stimuli into the new environment, interesting environment, which is safe, okay? This environment is safe with no threats. So the brain take a decision. I have to take a decision to change my situation from a proactive defensive mechanism into a guided motor command, which is called sensory motor network. And the patient will be able and promoted to change and take an action in a new environment, which facilitate his and her mobility in a real environment furthermore. Third mechanism is cognitive behavioral technique. In addition to make an interesting environment which distracts the brain from focusing on the brain from focusing on pain only, it also provides a relaxing environment This relaxing environment can facilitate changes of negative information and negative thoughts of pain into a positive experience, such like which occurred while guided imagery and mindfulness exercise. Desensitization and exposure therapy. This is a new era of rehabilitation used mainly for phantom pain, okay, and patients with burn pain. Desensitization and exposure therapy aim to gradually exposing individual to stimuli of pain trigger in controlled virtual environment, which can reduce the fear from the pain and the hypersensitivity of pain. Finally, rehabilitation and motor control. Virtual reality implementing customized and personalized exercise depends on the patient needs and patient capability. This exercise may trigger motor control, strength, coordination, which at the end improves the patient performance and patient condition and reduce the perception of pain. What is the exercise which virtual reality can offer? Actually, virtual reality can offer different exercises by implementing the exercise in the action of a game or a play, which is a leisure activity for the patient, which can be applied in the clinic or in the home. Stretching and flexibility exercise, as shown in the photos, okay, stretching and flexibility exercise promote more range of motion, making the patient more flexible, able to apply different action. Strengthening training exercise to improve the patient performance and muscle power and muscle control. Core stabilization, balance, and proprioception improve the balance of the patient and reduce the incidence of fall, which is high risk of our patient, especially geriatric patient. Low impact aerobic exercise, which facilitates the cardiorespiratory fitness of our patient, especially geriatric patient and obese patient. Finally, virtual reality depends on immersing subject on an interesting environment, depends on his abilities and his needs. Okay, this interesting environment can distract the subject from the painful stimuli and can facilitate his mobility by distracting him from the negative thoughts of moving while he is in pain, improving his motor performance. But unfortunately, till nowadays, virtual reality just is a discriminative therapy used with physiotherapy, traditional physiotherapy. There is a very, very little researches applied for virtual reality as a standalone exercise program. So it's recommended to apply virtual reality as a standalone exercise program and compare it with the traditional physiotherapy program. Also, there is a very little studies examining the efficacy of virtual reality on pain associated with sport injury in athlete subjects. Finally, take-home message, I accept the words said by Machona, be flexible like trees, when the wind blows, bend, but don't break. So, all of us have to be flexible and accept the researches, the recent research and recent approaches in physical therapy rehabilitation, which may improve our patients' capabilities and which improve our profession. But you have to be sure, don't forget the scientific rule which we work on. Thank you for your concentration and your audience. Thank you.